Hello and welcome to my channel, my respected friends and viewers. Today's vlog is kind of special. Collecting, screening, synthesizing, and then finalizing selection of information to include in this vlog was not easy. I came across real human sufferings. Imagine living in a town where you wait for many months to see a doctor, or having a surgery delayed so long that your condition worsen into something permanent. That's not fiction. It's happening in parts of rural Queensland and Tasmania. In fact, Tasmania outsourced over 4,000 public surgeries in just 6 months because their hospitals couldn't cope. Meanwhile, 82% of all health professions in Australia are now in shortage, including GPs, mental health workers, and aged care nurses. And it's not just the bush. In the suburb of our major cities, ambulance ramping is up. ED wait time have blown out, and aged care homes are closing their books on new residents. The Australian Institute of Health and Welfare confirms this strain is real and growing. So, how did we let one of the best healthcare systems in the world so far behind? Let's dive into what's really causing the crisis and who is paying the price. Today, we will uncover how underfunding, how fraud, and neglect are seriously affecting Australian patients. My presentation structure, I will cover some topics under access collapse, and this will include bulk billing, rural deserts, surgery delays. The second section is of systemic failures, where I will point out towards NDIS fraud, cyber attacks, and budget shortfalls. Health consequences is the third, where I will cover the mental health breakdown and rural suicides. Finally, the solutions and call to action. Yes, it is accurate to say that Australian healthcare system is under strain. Given the increasing delays in surgeries, longer wait times for doctors, particularly in rural areas, and a rise in mental health cases, these factors indicate a system struggling to meet the current demand placed upon it. What about the future if we are not going to fix it now? A significant number of elective surgeries are being postponed, with some patients waiting longer than acceptable. This includes both public and even private hospitals, and the situation is particularly acute for those needing non surgical specialist appointments, according to the RACGP. That's the Royal Australian College of General Practitioners, with 40,000 plus practicing members. Many rural and remote areas face shortages of general practitioners, leading to longer wait times and increased travel for appointments. This impact access to both routine care and preventive services. These delays inevitably led to a rebound effect, and now wait times in public hospitals for some specialities are over 6 years. In the past, one way to reduce the burden on the public system has been for patients to see private non GP. However, Dr. Rebecca Hoffman, a Sydney GP and a lecturer, says even in the private sector, there are significant delays now. The longest wait I know of is developmental pediatricians, pediatrics. This strain is exacerbated by long wait time for specialists' mental health care. These factors contribute to a system wide strain, leading to overcrowded emergency departments, longer wait times for specialist appointments, and greater reliance on telehealth services, according to Touch Bio Australia. So, system collapse. First, the bulk billing collapse. The billing rate plummeted to 36%, down from the earlier 66% in 2022. because people do not have the money and they delay to an extent where their preventable issues become more serious or permanent. Medicare rebate frozen at 39.75 versus $80 plus clinic costs. One in three Australians skip care due to cost. That's AIHW 2025. We can look into the case study of Blacktown, Sydney, that lost four clinics in 2023. Patients are now traveling 90 minutes for GP care. Question is, who's left behind when healthcare fails? Bulk billing is dying. Clinic lose $40 per patient due to frozen rebates, forcing them to charge fees or shut down. And that's what happened in the Blacktown. Four clinics closed. One of the patient in Blacktown was diabetic pensioner, and she was rationing insulin because she couldn't afford $100 consultation fee anymore. The AMA calls this economic triage, where the poor are denied care. This isn't inefficiency, it's systemic cruelty. Without reforms, more clinics will vanish and preventable deaths will rise. Rural GP desert. 1200 plus town lack a single GP. Broken Hill, one doctor per 3000 people. Aged care crisis, 80% of rural nursing home lack on site nurses. Brain drain, 50% of graduates leave regions within 5 years. We can look into the case study of Cloncurry, Queensland. Only GP flies in weekly. Emergencies are airlifted 500 kilometers. Rural healthcare has also become a postcode lottery. In Cloncurry, heart attack patients wait up to 3 hours for an airlift. Aged care residents in Mudgurry reports waiting delays for pain relief. Would the heart patient survive for 3 hours? How many of them will survive? The government's rural incentives are not more than a joke. $10,000 bonuses. It cannot compete with city salaries. This is, let me, with due respect, say a medical apartheid, and it's getting worse. I said with respect because at least somebody sitting in the policy making area did thought of, okay, yes, these people going to the rural areas deserve something better. The AMA report that 90% of rural doctors says funding and staffing shortages are the most critical system failures requiring urgent reform. That's the situation. Surgery delays wait list. Average wait 12 months for hips, 18 months for cataracts. Post COVID backlog 400,000 plus delayed surgeries nationwide. Private shift 60% payout out of pocket to skip queues. Case study can be of Sydney grandmother who waited for 2 years for knee replacement, now has become wheelchair bound. Public hospital zones are like war zones. A Sydney grandmother's knee surgery delayed until her cartilages eroded completely. She sold her car to go private, but most cannot do so. In 2020-21, Tasmania outsourced approximately 4,334 surgical procedures to private providers. Why isn't there a national policy to meet these situations? Because politicians have gold plated private insurances? This is sourced from tezgreenmps.org. Pulse Tasmania report 8,329 waitlisted. 338 cancelled in August 2024. Nearly 100 shifted to emergency services. Nearly 100 patients were removed from the waiting list and admitted for emergency services after delays in 23-24. June 2, 2024 Herald Sun's report. Our sixth state, the depth of Tasmanian health crisis. According to the Australian Institute of Health and Welfare, AIHW, median wait time for elected surgery blew out of 48 days in 2023, up from 39 in 2021. That's not just a number, it's Australians waiting in pain for months because the system cannot cope. NDIS fraud and mismanagement. Now, listen to this $8 billion wasted on fraudulent, inflated NDIS claims, we are missing hospitals' surgeries. We can develop hospitals with this amount. We can recruit from around the globe real professionals instead of relying on this fraudulent migrant agents bringing in unqualified fake certificates holder individuals into our system. Fake providers are ghost carers and they even bill for non existent services. Families face repeated billing disputes under delivery, especially for people with cerebral palsy. Family Families are facing repeated billing disputes under delivery and confusion over NDIS supported therapies, especially for people with cerebral palsy and similar disabilities. Sorry. Allied health reforms like the READ model have been implemented by Cerebral Palsy Alliance to improve transparency and evidence-based practice, but gaps remains. Still, it is widely believed that NDIS is being looted. Two former National Disability Insurance schemes NDIS providers in Sydney have been sentenced to jail for offenses involving 1.2 million in fraudulent claims, including claims for services never provided to the patients. The successful prosecutions were the result of Fraud Fusion Task Force investigation, May 23, 2025, ndis.gov.au reports. Cybersecurity threats to hospitals. I will be conducting a special vlog on cybersecurity and the criminals behind them and how much they have penetrated into our system because we let them. It's time to check them. In 2023, Medibank hacked 9.7 million health records, leaked, including mental health data. Ransomware hospitals forced to cancel surgeries like in Waikato, New Zealand attack. ASD, Australian Signal Directorate findings is 11% of cyber incidents target healthcare. Case study we can provide is of Royal Melbourne Hospital that reverted to paper chart for 3 weeks after an attack. Hackers now target lives, not just data. In New Zealand, a ransomware attack cancelled cancer surgeries for weeks. The Royal Melbourne Hospital's IT shutdown forced nurses to use paper. One nurse admitted fearing fatal dosing error. ASD warns healthcare is soft infrastructure for cyber criminals. Yet 70% of our hospitals lack mandatory encryptions. How many will die before we act? Government failures. Health budget grew just 1.2% per annum versus 4% in demand. GP training spot frozen at 1500 per year. Need is of 4000 plus. We can provide case study of 2024 budget where that allocated $15 billion for submarines but only $250 million for rural health. Successive governments starved the system. Medicare rebates are frozen, training sports slashed, and cybersecurity ignored. The 2024 budget prioritized submarines over surgeries. This isn't mismanagement, it's malice. Malice. However, this year in the health budget 25-26, government has amended mistake of previous years by making a record investment of $7.9 billion to provide more bulk billing to people can so that people can see general practitioners for free. This is the largest single investment in Medicare since its creation over 40 years ago. So, some credit to the present government. The government is expanding bulk billing incentive eligibility to cover all Australians from the 1st of November this year, 2025. This means an additional 15 million individuals will be eligible when visiting their GP for the most common services. 9 out of 10 GP visits are expected to be bulk billed by 2030. Mental health breakdown wait list 6 to 8 weeks wait for youth mental health services. That's the Headspace report 2025. Suicide rates up by 12% in rural areas since 2020. 3,000 plus dies by suicide in 2020. Only July 6, 2022, it was reported that more than 3,000 Australians died by suicide in 2020. This is report by Australian Institute of Health and Welfare. 1 in 5 Australian aged between 16 and 85 experience a mental health disorder, and in the 12 months before 2022, national study was suggesting that anxiety exists 17%, affective disorders 8%, and substance use 3%. AIHW. Over 3.4 million Australians accessed at least one mental health service via Medicare or PBS in 12 months period. Demand is outpacing the workforce. 82% of all health occupations were in shortage in 2023, with GP, nurses, and mental health professionals most affected. Solution: triple bulk billing incentives for GPs and underserved areas. So, those who are going to the far off, let them earn three times than what the people in the city facilities are earning. That may change the practices in near future. Fast track visas for foreign doctors, cut red tapeism. Mandate ASD essential. However, when I am saying fast track visas, I'll clarify some grave issues that are related to it. Mandate ASDs essential 8 cybersecurities for hospital. National surgery blitz with private partnerships. Fix the GP shortage by paying doctors fairly to work in the bush. Fast track qualified overseas GPs. Why make them wait for years for accreditation? But please check and validate their qualification. Australia cannot afford another doctor death on its surface or fake qualified medical practitioners, including nurses and other support workers. Fake doctors might seem like the stuff of fiction, but they are real and more common than you think. That's the ABC report, Sunday, 5th September 2021. The idea of a layperson trying to pass themselves off as a medical professional might seem far fetched, but it's disturbingly common occurrence in Australia. In early August, it was reported that a woman who had failed her medical exam posed as a doctor for 8 months at a major Sydney hospital before being stood down and referred to the New South Wales police. That prompted the state health authorities to order an audit of registration of all the doctors in New South Wales. If someone is not on the Australian Health Practitioners Regulators AHPRA's book, they cannot legally practice. Yet sometimes they do. And it's not only the role of medical doctor, they fake. They fake many other roles in this field. There have been cases of imposters nurses, dentists, pharmacists, and psychologists too including a Western Australia man who was recently convicted of fraud after seeing patients under the guise of being a university qualified and professionally registered, neither of which was true. Hospitals must adopt also AST cybersecurity rules, and a surgery blitz like Victoria's COVID catch up could clear the backlog in 18 months. The solutions exist. We need political will to back it up. Sorry. Call to action. You can email to your MPs. Why must pensioners choose between food and medicines? Support rural doctors via Rural Health Alliance. Report cyber risk to ast cyber.gov.au. Healthcare is a right, not a privilege. Demand your MPs to boost Medicare rebates. Donate to rural doctor scholarships. Report suspicious hospitals' IT activities. AST can help. Share this video. Every voice speeds reform. And if you like, please do subscribe. What references I have used are many. Some are in front of you on the screen and some not. I have written on my notes side. I can go on. There are at least 3 to 4 slides covering it. NDIS Quality and Safeguard Commission report complaint provider suspicions and systemic failures. Guardian Australia, the conversation 2023-24, rural healthcare collapse, especially in Tasmania and remote Queensland. Medical Journals of Australia and RAC GP reports, GP shortages, burnout rates, and regional doctors' gaps. Sydney Morning Herald, the Age reports billing frauds and care providers overcharging. For example, up to $200 an hour despite no show therapy case. References continue. I will not take your time on it, but you are more than welcome to go through it. And if you have any questions, do ask. Place it in comments. I will be happy to respond. Thank you for your attention. But just before, sorry, I finish, let me say something which I wanted to say. That yes, I am pointing out some issues, problems. Australia, nevertheless, is still among the better nations in the world when it comes to healthcare access and public infrastructure. But the purpose of highlighting these issues is not to discredit, it is to caution. Alarming trends like the shortage of genuine health professionals and dodgy migration agents bringing fake or unqualified from overseas has started threatening the system. The real life cases of fake doctors slipping through the cracks show that our system is under growing strain. If we did not act now, we risk eroding the very standards we take pride in. This is a call to protect the future of Australia and us, the Australians. Thank you for your attention. Stay tuned. My next vlog will cover our issue number 4 that will touch the topics of climate, energy, and AUKUS. Till then, you look after yourself. Take care. Bye bye for now.